In this tutorial, we're going to go over etiquette in healthcare. So, what is etiquette? Etiquette is the process of how the health professional interacts with patients, other health professionals, patients' family, and just other health caregivers. So that is etiquette. Just your interaction as a health profession with a patient that you are taking care of, or that you are working with or working on, and also your interaction with the family of the patient, your fellow health professionals, and also just other health caregivers. So etiquette refers to the various manners and behaviors prescribed and observed in social life. So social life, the way we get to interact with other people. How do we get to interact socially or in association with others? So all those manners, that is etiquette. So, how the health professional interacts with patient's family, and other health professionals can have a very big impact on profession success and the impression they create about their profession, facility, and themselves. So, the way we get to interact with a lot of people, that can have a very big impact on our success. Imagine your interaction with people is very bad, so you might not know someone you are interacting with badly. Might just be someone who is the boss of a company that you'd want to start a job with. So really, having a good interaction with people is part of one's success. And if you get to interact with people, that gives an impression about your profession. Maybe your profession, it shows more about your profession. If you are really trained to do that thing that you are doing, and also about the facility where you are working, the way you get to show or conduct yourself talks more about where you are, where you work, and also just about yourself. The way you get to interact, the way you get to show forth yourself is going to talk more about yourself. Okay. So there are some etiquette guidelines as a health professional, things that you need to do. So every time that you are getting to interact with patients, or just when you are new in a workplace as a health profession, you need to make sure that you get to introduce yourself. You need to introduce your name and your job title. This is very, very important, because if you imagine you just reach to where a patient is and you start working on them, they might be even afraid. What of if this one has just come wants to kill me? So that's why you need to introduce your name and also job title. That is why health professionals work with IDs on their necks for identity's sake. So also you need to be able to explain your mission. What is your mission, or what is your profession if you get to find other health professionals in a new place, or when you are working on patients. So you need to tell them also how long you are going to be with them. Don't use technical terms to get explained. Just make sure the language is easy for people to get to understand. And also, it is very, very important to ask questions. That is professional inquiry. Imagine you want to perform a procedure, you don't know more about it, and you don't want to ask. What if someone gets killed? So make sure that you get to ask about procedures and where some things are kept. That is for the very good. Okay. And also make sure that you focus on the patient. If you are doing anything and you are talking to a patient, you better get just to put away what you are doing and concentrate on the patient. That is patient focus. Because if you do not get to concentrate on the patient might not feel that comfortable with you. So take time to pause anything that you might be doing, just to with the patient. And also, we need to be mindful of the body language as health professionals. So be aware of your body language. Keep your head up and maintain normal eye contact. Use a sincere smile to convey warmth and friendliness. So the body language is very important. A smile, just that smile, that is going to give also a positive attitude to the patient or even to other people. That is why we always need to make sure that we have got a positive attitude that is going to encourage those we are interacting with. We need to be that friendly, and just to have that state of warmth, so that people are just going to feel comfortable being near us. And also, we need to have that common courtesy, just to be, just to be people who people are going to find interesting. When you are getting to speak, use words like please, thank you, always, and many times, so that people are going to know you have got that courtesy, you have got respect. That is professionalism. So be polite whenever you're interacting with others. Some people you might be interacting with can be people of a lower position than yourself. But it is always important to be polite with colleagues, any interaction. And that is very important. Avoid nicknames when interacting with patients and just even other health professionals. You need to be formal. Nicknames are informal. Those you get to speak to or to call people on their nicknames when it is out of the office. All right. So also remember patient's privacy. So remember to follow privacy and confidentiality. Ask or follow up information about patients private so that other patients or visitors won't overhear. Now, when you hear about something about